Today is World Patient Safety Day, and the focus is on safe maternal and newborn care. In this video, we speak with Kate Lyons, who is the project manager for MaternityONESouth. Kate is based in Cork University Maternity Hospital.
This is a project that is designed to try and improve the network of maternity hospitals in Ireland South. So we have now got an Ireland South Women and Infants Directorate, which is made up of the 4 maternity hospitals of Cork University Maternity Hospital, University Hospital Kerry, Tipperary University Hospital, and University Hospital Waterford. So it's a real collaborative effort from 4 hospitals and from all disciplines to try and improve training for staff and access to policies so that we can improve outcomes for women and babies. Obstetric and neonatal emergencies are a real everyday occurrence for all of us working in clinical practice, and we'd like our staff to be able to deal with these and doing so that if they feel confident and competent around dealing with emergencies, that outcomes will be better for women and babies. So the MaternityONESouth project improves patient safety because what the aim of the project is to bring all of our policies, procedures and guidelines in relation to obstetric and neonatal emergencies together into one central repository. So we have easy access to the policies in the first place for all of our staff, and also to develop a kind of a training strategy so staff can attend training in obstetric and neonatal emergencies. And clearly, by having access to evidence-based guidelines that are developed by experts from all members of the multidisciplinary team, and also by having access to high-quality multi-professional training, then we improve communication with each other. And obviously, when you practice in a kind of a scenario, then when the emergency happens at the bedside, that things usually work out to be much better. So the introduction of this quality management information system has assisted clinicians in looking at our own governance structures around development of policies, procedures and guidelines, and has been able to give us a very clear pathway on how you develop a policy, and having that policy, procedure and guideline committee having an oversight of policies that are being developed. So by bringing all of the policies together, HCI have been able to help us to let our staff have access to them in one central repository, firstly, but also the train scan will really help when staff attend training, that they'll be able to scan their own barcode on their ID badges. By doing this, it'll mean that it'll update their own personal professional portfolio of training that they've attended. And then if you're a manager, you'd be able to see for your department, or if we wanted to look at the whole hospital or indeed at the whole directorate, then that's really great for planning and developing a strategy. It's also when HICWA came, when they were looking, and what we're trying to do is implement their recommendations in relation to obstetric and neonatal emergencies. So when they came, they asked us how many of your staff, for example, have attended their neonatal resuscitation program. And that information was being fed into many different places and wasn't always easy to access. So now, because we're going to be able to bring all of those training records together for the whole directorate, it means when HICWA come back, and I'm sure they will, we will be able to provide them with that information. So it gives great transparency, and it allows us to see what we're doing well, what we need to improve on, and I think that's good for the service, really. I work with very motivated and skilled nurses, midwives, obstetricians, neonatologists, allied health, members of education who work within all of our hospitals in the Ireland South Women and Infant Directorate. And really what we're trying to do is pull on all of that expertise, bring it together and reduce the amount of duplication that's happening in smaller units, or sometimes in larger units too. So ultimately that we can be more efficient, that we can have the same agenda, and we're really trying to just improve things for women and for babies and for the staff working within our services. But that wouldn't be possible without their hard work and their commitment when they come to work every day. And the WHO's I guess their slogan to try and improve respectful childbirth for women and for families has never been more pertinent. So that's what Maternity OneSouth would like to do. We'd like to make that a focus.